Well, sometimes you can follow a nutritious diet, you can exercise, and yet the weight still doesn't come off.
Bariatric surgery may be worth exploring, and it's not just about being a certain size. For many men and women, it's about being healthy.
It is. Here today, CHI Health Bariatric Surgeon, Dr. Kalyana Nandipati. Good to see you, doctor. Thanks for stopping by this morning.
Thank you.
Pleasure to be here.
When we talk about bariatric surgery, it could involve a number of different procedures, right?
Yes.
And we'll get to some of those, but I want to talk about your experience because you've got a lot of experience in this field, right?
Well, we've been doing it for a while, and we have done more than 400 procedures. And actually, I wouldn't say it's a difficult thing to do. I think the more experience you have, you get used to doing it, and it's a difficult patients to take care of. And it's always a pleasure to help people and making them healthy, as you pointed out before.
And you're not bragging on yourself,
Nope.
but he's written dozens of articles,
Yes.
which his peers turn to in numerous publications. So that's one of the reasons we were glad he could be here today to talk about it. Who's an ideal candidate for surgery when someone comes in? Are there parameters that you look at?
Yeah, we actually go by their body mass index. As you can see in the screen, if your body mass index achieves actually your weight by height is above 40, or if it is above 35 with comorbid conditions such as diabetes. We talk a lot about comorbid conditions. There are a lot of them. I think some of we are looking at is the obesity-related comorbid conditions. Majority of them are diabetes, hypertension, sleep apnea, and hypercholesterolemia.
Yeah, and that's one of the things we want to talk about because it's not just about weight loss. There's other factors here that we're talking about, and it really gives patients a new outlook on life.
Definitely, definitely. I think for a lot of people, when you talk about bariatric surgery, they think, hey, I want to become skinny. But that's not actually completely the main picture. We're talking about type 2 diabetes, and there is actually there's a worldwide incidence of type 2 diabetes going up in the next 10, 15 years. And we're thinking about by 2030, is about 430 million people with diabetes. And they always have difficult time in controlling the blood sugar. And when you go to the doctors, they keep adding the medications.
Yeah.
I think that's probably the more, I think more than 50% reported that, it's just more than diabetes.
That's amazing.
That is an incredible number right there. So more than 50% reported no more diabetes. So half the people with bariatric surgery.
So there is a recent randomized controlled trials which actually published, especially from the US, from Cleveland Clinic in Ohio. They suggested at least after 4 years after the surgery, whichever the weight loss surgery you're talking about, at least more than 50% don't use any medication.
That's amazing.
That's the incredible story that is coming out recently.
And that's why we say this overall health picture is what it's about.
Yes.
Does insurance, because of some of the things that are happening with diabetes and blood, does insurance ever cover the cost of bariatric
majority
surgery?
of the insurances are actually on board nowadays, but some of the insurances are still not on board. I think that's, excuse me. I think that's the important thing that you have to check as an employer, whether your employer actually has a coverage for weight loss surgery. Because a lot of people's notion is weight loss surgery is still cosmetic. That's no longer is the right thing actually. Weight loss surgery is shown to be saving your life and actually it's shown to prolong your life completely.
It's worth checking with your insurance provider to see.
Yes, it is. We talked about the different procedures. Let's break this down a little bit because there's 3 different surgical procedures when it comes to bariatric surgery.
And maybe we'll start with the one you have.
So we have a model right here. This is called as laparoscopic adjustable gastric band, and you can see this plastic band that is placed inside of your stomach, around your stomach, and make it a small pouch. You can see really small pouch, which is about probably a 30 to 40 cc. That means at a time you can only eat 30 to 40 cc. By limiting the amount that you can eat, really that's how you lose a lot of weight. And this has been there for the last 15 years. It's the least invasive procedure. And this is the actually the third most commonly done procedure. It used to be the most common one 10 years ago. And the other procedures are, it's called a sleeve gastrectomy. Do we have the pictures?
I don't know if we do.
I don't know if we have the pictures.
We do. We know what we do have pictures of, and I don't want to run out of time before we get to the success stories.
I think that's actually the sleeve gastrectomy. This is probably recently the most commonly done procedure. And this is also least invasive, and it is actually have a good long-term results. And the third one is the gastric bypass. This has been out there for a long time.
A lot of people have heard about that.
Yes, and it's also called as Roan Y.
Can we look at before and after? Because though we're focusing on the health picture here.
Yes.
Being able to see the changes,
Yes.
Right, is a huge deal for your patients.
Yes.
And so someone like this woman, this is a local woman who's
Yes.
seeing great results.
And also the other important side of the story that I can add to it is the diabetes. And this person was using a lot of medications for the diabetes and more than a year out right now. And she's not on any diabetic medication.
And her joints have got to feel better.
Yes.
I mean, all around she's got to feel like $1 million.
And she's running around the kids a lot. And that's the most
great.
important thing she points out
She
to
looks
me.
fantastic. Which questions should patients ask themselves before they commit to bariatric surgery, whether it's one of these 3 procedures?
I think the first thing is whether they're actually ready. Ready means are they actually comply with the necessary follow-up that you need to do. I think surgery is just a tool, but you still have to be healthy. Healthy lifestyle is most important thing. And you have to go through the workup as the preoperative workup, and you're looking at the right reasons why you want to do the bariatric surgery. You're looking at the healthy side effects of the bariatric surgery rather than just looking at the weight loss part of it.
Yeah.
Multidisciplinary team covering all aspects, I know. And maybe one of the places to start is with one of the free seminars to just educate yourself. So you can start to ask more of those questions. Is this right for me? What does this mean long term? You will need to RSVP though, but it's the second Wednesday of every month from 6 until 7. So you're just carving out an hour to learn more. But call the number on the screen now, and then we'll show you some information too here about getting in touch. If you're ready, maybe ready to take the step to see if you could be a little bit lighter, but above all, to be healthier. It's 717-4846, and then online, chihealth.com.
Yeah, doctor, the impact this has on diabetes surprised me, how big of an impact it was.
I think it's a good long-term success story.
It's so encouraging.
Yes.
It is. Thank you for
Doctor,
educating us
thanks.
today.
Good to see you.
Nice to be
Yeah,
here.
thanks for stopping
by.
Pleasure to be
All
here.
right.
Yeah, thank
Thank
you.
you.
All right, Mexico, it's one of my favorite places to visit. I can't recommend it high enough.
Yeah, we're talking about Mexico, where you should go, best time to go. It's all like we're heading south, and look at that scene in Travel Tuesday.
16-year-old